Now, if you think about it, we talk about underserved areas in the veterinary field, and we think about low population areas. But this is in the center of Los Angeles with 20 million people, and there are no veterinarians in those communities. So there's no easy access or affordable access to basic care, vaccination, spay, neuter, deworm, microchip. And so Downtown Dog Rescue, through grants, provides these services, and the veterinarians and the staff and the doctors and the managers and the animal caretakers, the receptionists, all come together once a month in South Central Los Angeles to provide free veterinary services for upwards of 200, 250 pet owners in the community.
This is Betsy. My Betsy, I found her in November of last year on the street. I took her in. She was in really bad condition. She had 2 ear infections. I haven't had a chance to take her to the vet yet because of money problems. So I drove by here and I saw that free clinic sign. I thought, oh my God, this is great. I can't pass it off.
We have it set up almost like a little, like a pet fair. So one booth is vaccines, another one is deworming, another one is microchip. So the idea is everybody visits all the booths. So when we start a typical clinic in a new location, less than half are spayed and neutered. When we're here, in this case, for a year, we're in the high 80s, 90% in compliance rate, which means they're not only spayed or neutered, but they're also up to date on all their vaccinations, they're receiving parasite medication, so we're seeing healthier dogs.
Good boy. Oh.
When we started the program with the SCVMA, the rates of parvo were very high. We saw it at our shelter that we work out of in South LA. And after, I think it was about 3 years of doing these clinics, and of course partnering with different other organizations, we saw our parvo rate for this area go down by 42%.
They may never see another veterinarian. They may never have another service provided again, but we're trying to prevent the rabies epidemics that could have come. We're trying to prevent the distemper and parvo things that could come. They all get dewormed. They also get microchipped. And those pets that aren't spayed or neutered, we get them signed up for free spay and neuter. The goal being prevent disease and pet population control.
It makes me feel awesome to know not only are we vaccinating, we're providing health care, but we're also providing a realistic education, because it's one thing to have things on websites or hand somebody a flyer, but it's so much more meaningful if you can take a whole family, kids, grandma, grandpa, mom, dad, everybody, get them here to the park and have them experience what they need to be doing, because people just need to be taught.
We used to take him to a place where we had to pay. So it's really helpful because we didn't have the money. He needed already his shots like 2 months ago, but we couldn't take him. So we feel happy, and now we won't worry about him anymore. He has everything done right now.
Looking back, you know, I have all these little stories, and I tell my wife all these stories about all these animals that we had and all these illnesses that they had. And, you know, the little things that we did to make them feel better, which in retrospect was not so great. And you know, I just keep flashing back to those things and thinking, I mean, I'm in a position where I can do something different. So that's pretty much it. When I saw that, I was like, yeah, I want to be a part of it. All right, cool. Right on, man. Yeah, good to see you, dude. Yeah, same here. Sorry, my hands. When I'm volunteering, it's more just kind of providing people with some information, some basic information, and just wellness stuff. So it's kind of nice. Whereas in practice, you know, we get really sick animals a lot of times, and of course there's a practice management aspect, which, you know, just managing employees and all that stuff, I don't have to deal with it here. Here it's fun.
I mean, if you really want to make yourself feel better at the end of a long, hard week, even if you've worked 6 days, go work a clinic and just help other people feel good. It'll make you feel good. It's just a warm, fuzzy end-of-day feeling that I really do think can address many of the stressors that we have in our practices while concurrently making a difference.
What was it like the first time you saw Sammy?
I thought it was just a little plushie in my blanket, and then when I touched it, it looked at me, and I was like, ah! I was like screaming with joy.